In honor of Asian American and Pacific Islander Heritage Month in the US, Michael and I thought that it would be a great opportunity for us to raise awareness, celebrate the numerous contributions and achievements of the AAPI community, and at the same time, shed light on the concerns and needs of the community in order to find long-term ways to support them. So what does AAPI mean? The acronym AAPI stands for Asian American and Pacific Islander. It is a wide-ranging term used to describe all cultures across the continent of Asia and the Pacific Islands of Melanesia, Micronesia, and Polynesia, representing approximately 50 ethnic groups and over 100 languages. Now, the history of the AAPI Heritage Month in the US can be traced back to the late 1970s, when it was actually just celebrated as a week, up until 1990, when it was expanded to a month. In 1992, Congress passed a law which annually designated May as AAPI month. The month of May was actually chosen to commemorate the immigration of the first Japanese people to the United States on May 7th, 1843, and to mark the anniversary of the completion of the Transcontinental Railroad on May 10th, 1869, which was largely worked on by Chinese immigrants. There is an incredible depth and richness of diversity found within the AAPI community, and this month is devoted to recognizing and elevating their cultural, social, and economic contribution to the United States. It is also a time to reflect on the challenges faced by the AAPI community throughout history and at large in the last couple of years, and how we can all stand together towards creating a more inclusive world. And given that there's so much diversity and cultural richness within AAPI, we've actually now started to discover the existence of disparate minorities even within the AAPI community. Therefore, cultural mindfulness needs to evolve to increase awareness about these subgroups as well.
Thanks, Adi. So what does AAPI representation look like in the industry? So right now, in terms of healthcare workers in the United States, there's 71.6% of the healthcare workforce representation of AAPI in Hawaii, 26.3% in California, and 19% in Nevada. So if you take those numbers, that's pretty much 1 in 5 physicians or 1 in 11 nurses nationally. In the UK, Asian people actually made up 10.7% of the NHS workforce. 30.2% of medical staff are Asian and 31.4% of senior doctors are Asian. And in the biomedical field, 1 in 6 are representative in the pharmaceutical and medical manufacturing industries, 1 in 7 in medical equipment and supplies manufacturing, and 1 in 9 in pharmacies and drugstores. Next slide, please. Certain diseases and health problems have been shown to impact members of the AAPI community more than others. Nearly half of the 1 million people with chronic Hep B infections are AAPI. Chronic liver disease is the leading cause of death in Asian Americans, and Asian males have higher mortality rates compared to other populations. There's also lower health screening and preventative health seeking behaviors amongst this community. And in terms of mental health, this is still heavily stigmatized in Asian American communities and are 3 times less likely to seek mental health services than other Americans. Therefore, it's very difficult to collect accurate statistics around this health condition. AAPI still experience difficulties with Medicaid enrollment due to language barriers, although there is minimal research on this. And the Affordable Care Act in the United States has done a lot to advance data disaggregation efforts, but much more needs to be done so that we can create a fuller and more accurate history and in turn better interventions for this population. Next slide. So there has been a history of propagated xenophobia and hostility towards AAPIs, and this often arises during times of outbreaks. So historically, during the smallpox outbreaks of the 19th century, Chinese Americans became scapegoats. A similar account occurred for Japanese immigrants during the early 1900s as they were associated with the bubonic plague. And then from the time the US colonized the Philippines in the late 19th century, US health officials referred to Filipinos as incubators of leprosy and used this rhetoric to justify their colonization. At the beginning of the COVID-19 pandemic, racist and xenophobic rhetoric about the origins of the virus led to a spike in anti-Asian racism and violence, with AAPI people of all ages and cultures being verbally and physically harassed and murdered in cities across the United States. This is what is being done in our society to overcome these challenges. The COVID-19 Hate Crimes Act was released in 2021 in response to the prevalence of hostile attacks towards AAPI at the height of the current pandemic. And with that came the passage of the Jabara Hire No Hate Act, which seeks to promote better hate crimes data collection, as well as more informed approach to hate crime prevention at the federal, state, and local levels. For our society to recognize the humanity in us, we must work together to root out bigotry that has plagued our country for generations. As our national consciousness seems to reawaken to the violence and hatred that far too often plague our communities, the urgency of now could not be fiercer. Next slide. So these are a few of the historical contributors in the sciences. The first one is Anandibai Gopal Rao Joshi, who was the first Indian female doctor of Western medicine. She was the first woman from the Mumbai presidency of India to study and graduate with a 2-year degree in Western medicine in the United States. Next is Min Chue Chang. He produced findings that are important and valuable to many areas in the field of fertilization, including his work in vitro fertilization, or IVF, which led to the first test tube baby. He was best known to the world for his contribution to the development of the combined oral contraceptive pill. Har Gobind Khorana was part of the team that developed the first synthetic protein. Scientists who use the CRISPR and Cas9 genome editing system today are building on the legacy of that first artificial protein that Dr. Khorana worked on. Barry Pa was a Burmese American biologist, and he was notable for his role in discovering a new gene in humans that contributes to the production of hemoglobin. And last but not least, Flossie Wong Stahl was a Chinese American virologist and molecular biologist. She was the first scientist to clone HIV and determine the function of its genes, which was a major step in proving that HIV is the cause of AIDS.
All right, so representation means visibility. Visibility means normalizing API as real people and not stereotypes. Visibility goes beyond community organizing and legislation. Therefore, we believe that books, movies, and music are powerful tools in sharing culture. You can support API creators by intentionally seeking out API-made media, from a television show to binge watch with your friends, to a book by an API author whose work you've never read. And by supporting API creators, you're supporting the idea that API voices deserve a place at the table in mainstream media. These works of art promote understanding, give voice to our humanity, and help us become stewards of our deeply rich and varied histories. So let's honor the achievements and contributions of the API community by engaging with the stories, art, and individuals that inspire us this month and every month. And before we conclude, one of the things that Michael and I really wanted to convey is that celebrating any ethnicity, culture, or heritage shouldn't be restricted to just a PowerPoint slide deck, but pushing for inclusive conversations beyond any given history month is imperative. We need to promote awareness, empower each other to stand together and show solidarity. And inclusivity means understanding the differences that exist, but at the same time, strengthening connections by bridging diversity. And finally, being inclusive doesn't mean you need to fit in to be accepted or represented. It means that you are welcome to be who you are instead of who you should be. Thank you.